We had two really traumatic events in my family happen concurrently, and to go through them at the same time was just mind-numbing almost. And to kind of regroup and kind of take a deep breath and figure out what to do as a family, we'd come here. You know, it's amazing, the light, the natural beauty of the plants that are in here. It's really something you wouldn't expect from a very busy hospital. You know, we are pretty convinced that having a positive healing environment made for a much better positive outcome for my family.
Well, the goals for the project were to, number one, remain downtown, the location that we've been in for over 100 years. We wanted to create a healing environment for patients and families. We really wanted to transform the culture of our institution, inspire people, and ultimately improve performance. When we realized that this was truly a once-in-a-lifetime opportunity, we wanted to make sure we were taking full advantage of taking a look at our culture, at our staff, at the way we interacted with patients. We truly tried to make it about more than a building project, but really more of a cultural transformation and making sure that we were transforming ourselves to become relevant for the future.
So once the decision was made to build the new Bronson in downtown Kalamazoo in an urban environment, we wanted to create a facility that really reflected an urban environment, but also incorporated healthy living and sustainability principles. The idea behind the horizontal design of the facility was to really provide ease of access to all the services across a service line. So for example, the idea would be to bring a patient downtown, park in structured parking. At the level they're going to be getting services, they can flow through the system horizontally with ease. So in the end, we were trying to provide for efficiency for our patients, their families, and our providers and staff.
One of the most interesting things when we were thinking about designing the new Bronson was that we really didn't have any evidence or research on how different design opportunities would change the way people behaved in buildings. We had common sense, but we didn't have data and we didn't have research. So many of the things incorporated into Bronson were really done on the basis of intuition and common sense. And Bronson went way out on a limb in a way to say these are things important to us, even though we don't have evidence. Well, I think Bronson, especially among community hospitals, was very quickly known as a very successful institution, not just in terms of the quality of the care delivered, but their attention to how care was delivered and putting the patient at the center of it all. And that really made many hospitals think, we should be able to do the same thing ourselves, that there was really a lot to learn from Bronson.
At the time, Bronson was one of the early hospitals to consider an all-private room environment. So now that standard has become common across the industry for new hospital design. We've been able to show a reduction in complications due to the private room environment. Patients are more satisfied. They have a better relationship, a better ownership of their care. Bronson does things in a first-class way in everything that we do. And so that's an essential part of Bronson culture, and this building has really allowed us to do that.
When Bronson announced that they were going to build their new facility in downtown Kalamazoo in virtually what was a brownfield, I think they formed a catalyst for what's happening in downtown Kalamazoo today. When you have something as important as Bronson Healthcare investing in the community, the region, and saying, yes, we want to be a part of it, it made a big difference in our future.
I think the thing I'm most proud of with this project is that it has endured the test of time. We've really been able to transform the culture of the medical community in our area. I think people look to us for leadership, and we can look at the results of what we've done, really benefiting the community and ultimately benefiting patients and families in our area.